Welcome to another episode of I Quit My Job. I'm Slowly Plus One. In this episode, it's all about that defining moment when you're either leaving something that was no longer serving you. It could be a job, it could be a career. It's not feeding your needs and you walk away from it. And so this is what I Quit My Job is all about. So Paul, thank you so much, man. That was really cool for showing up. So give us a little bit about who you are.
Hi, everybody.
Everybody. Give me that one person in their living room.
Knowing you slowly, I'm sure there's a lot of people.
Oh,
I'm just happy to be part of your community.
nice.
So,
Nice.
yeah.
I appreciate that.
I'd be happy to introduce myself. I'm Paul Oy, and I'm, as slowly mentioned, I'm a Zen student. I actually attend Oak Tree in the Garden, but I'm also a physician and a psychiatrist. I work in 3 different clinics. One clinic serving artists at the Artist Health Center, but I also work at Remedy, where I help support and provide psychedelic assisted psychotherapy. And periodically, I work at Suari Hospital providing general psychiatry.
Wow. So you cover all gamuts of that whole field. That's amazing, man. Okay. So
Thanks.
let me jump into this a little bit. So you're in the traditional field of psychiatry and you're following the methods of, the pill works and that's what they're going to do. They give you a pill for everything. So when did it all change? Like to say, I want to walk away from this traditional approach or I want to give a different appeal to it.
It's interesting because in some ways, I'm sticking to a tradition that's even older than the biomedical view of psychiatry.
Mm-hmm.
Before we discovered antidepressants, the way people recovered from mental illness was through psychotherapy,
Right.
conversation, and soulful dialogue with a caring individual who studied the mind. How I got there was way before I got into medical school. I was training to be a doctor. I wasn't even thinking about psychiatry, actually. Back in undergrad, I was training to be an emergency room physician and maybe a surgeon, much like my mentor, Dr. Norman Bethune, or my hero, Dr. Norman Bethune. As I was preparing to get into medical school, I was studying for the MCAT and I was working a lab job that I was trying to put on my resume and I was volunteering my brains out and I didn't have time for friends and I was often questioning, what am I doing? And then I had massive depression, just trying to think about, is this what the rest of my life is like? Am I going to just be working disconnected from my community and not clear about my purpose for the rest of my life? Unfortunately, I was in an undergrad faculty where they gave me a lot of space to explore, okay, so why do I want to be a doctor? What deep need, what deep ask is being fulfilled when I want to do medicine? One of the things I got to do was read the memoirs of different physicians, surgeons, emergency room doctors, doctors that were without borders. My favorite memoir was the memoir of a psychiatrist, Dr. Irvin Yalom, who wrote a whole book of different therapies where he screwed up, but because he was in an authentic relationship with his patients, they figured it out. And in fact, the difficulty, the disagreement became the source of the healing. And I thought to myself, that's the kind of medicine I
That's
want.
amazing. That's amazing. I love that. And then both you, the patient, and the physicians working together
Absolutely.
to figure it out. I mean, don't they try those things now in different forms where if I'm the patient and I'm with you, then I give you like what the issues are, and don't we work together? Or do you just like take your sense of it and then the patient just accepts it?
Yeah, that is actually a deep and fascinating question. I think ideally in any medical relationship, psychiatry, general medicine, otherwise, any kind of discipline, the physician and the patient work together to discover what are the best options. In the case of psychiatry, ideally that kind of conversation spans a person's mind, a person's life, their history, and in the best cases, that's exactly what happens. I know many of my colleagues are deeply committed to their patients, figuring out the nature of their pain, which is usually quite complex. However, we live and work and try to serve in an environment where there's not a lot of time, and there's such a high demand where the only time available is finding a medication that might help. I've been very fortunate, however, to find myself in a practice where I get to have those kinds of deep soul-searching conversations.
And so you do with artists. So how does that work? And how does artists reflect and share what they're going through? Like, what was the change?
I think artists first are human beings. They deal with their issues the way all of us do, but artists have a unique, rare, and I think underestimated capacity to work through their human issues through the medium of art, through song, through dance, through writing. That's quite a gift. And I think it's not a vulnerability, but actually a huge strength that artists are able to reflect and experience and transform their human pain into something that can inspire and move and touch other people's. I think on top of that, artists at this point in time face all kinds of cultural and economic pressure. And never have artists had to face the threat of precarity. You know, the way AI is creating less and less breathing room for people to have a genuinely human and creative process and the push to create content again and again and again. Meanwhile, the actual artistic process is often disregarded or not even seen as relevant. When at this point in time, when we're facing multiple different challenges at all levels of being, art is necessary for us to create the solutions that can help and serve all. Artists know their issues are human and that their gift to all of this is their imagination.
So when you're stepping away from the traditional, and then, you know, to me, that's really cool that you deal with artists. Was it like a rebellion? You know what I mean? Like you're stepping away from the system. And
Yes, because I decided, like I said, you know, following the footsteps of my hero, Norman Bethune, to be a physician that was oriented towards social justice. Like I knew at the age of 6 or 7, pretty young, that I wanted to be a doctor because I didn't want to charge any patients for healing. And I somehow knew about the OHIP system. And I was like, well, I better do that. And once I became a psychiatrist and I started dedicating myself to that craft, I read a book by the same author, Irvin Yalom, who inspired me to be a psychiatrist in the first place, a book called The Gift of Therapy, in which he described how psychiatry was changing quickly due to the shifting economic conditions that have it well underway. And I realized that if I wanted, the OHIP billing codes still allowed me to be a psychiatrist, but I would have to kind of chart my own path in creating a curriculum that would actually set me up to be a psychotherapist. So in my residency, I pursued all kinds of unique training opportunities. Like, for example, I worked with a social worker instead of an inpatient unit to study emotions and how to provide emotion-focused therapy. And I think the real rebellion for me was actually quite a subtle one. I was in my 5th year of residency. I was going through the standardized exams. I knew because of way back before medical school, I wanted to be a psychotherapist serving the community.
Right.
So I didn't sign any contracts. I just kind of waited, focused on studying. And I thought to myself, you know, it's feeling pretty nerve-wracking not knowing where my career is going to go as soon as I finish.
Right.
But at the graduation dinner, just having dinner with a friend, they mentioned another colleague of theirs was looking for a psychotherapist and psychiatrist to help out at an artist clinic.
So now you stepped away. How did that feel?
Absolutely terrifying. Because up until the end of residency, I always had a supervisor, a mentor, someone to share responsibility at the Artist Health Center. And I realized I'm the only one. Like, I'm the one making the decisions. I'm going to choose whether there's a med. I'm going to figure out, like, who to involve in this person's care. I'm going to decide, does this person have depression or anxiety or something else? I could feel the weight of it immediately. Fortunately, you know, in those early years, I got a ton of supervision. I talked to my friends, and that helped me get through. I would say it felt natural. I think it felt less like a rebellion and more like backcountry camping, like more like discovering, okay, so where is the best place to land? What do I need today? How cold is it? How hot is it? You know, similarly with my patients, I often, even then and now, I'm like, how much of this kind of therapy does this person need versus how much do we need to experience and appreciate the fact that they're in a very human moment.
Nice. And that's all part of the healing process. That's part of that curriculum to put that patient through.
Absolutely. I say to all of my patients at the beginning of therapy, the purpose of therapy is to help you learn to trust yourself. The therapy will end at a certain point, but you can count on the fact that I will be with you, helping you listen to your intuitions, think through your thoughts, and be able to make decisions that reflect the values of.
On that point, how did the patients respond to that?
To speak to the dignity and the caliber of the people I get to serve, everyone's into it. One of the greatest gifts I've received in my training and in my practice of medicine is just how smart, intelligent, caring, and capable human beings are. More and more as time goes on, I find it easier and easier to empower patients, and I relate to them. Usually they know they're happy to use this opportunity to become more fully themselves.
Wow. So with that patience, was there ever a moment where you questioned that decision just based on the fact that you're giving new approaches? And was it frustrating to if they weren't accepting that new approach, or was everybody just on board?
I think in many therapies, there are turning points where it becomes clear that maybe a patient was looking for something different than what I'm trying to offer. Or I get a sense of oh, this person is struggling or facing so much challenge that this can take a lot longer than I thought. Also, there are times where it's clear to me I'm not the person for this job.
Okay.
I can offer as much as I can, but there's something about my personality or my training that may be not compatible with this person. There's all kinds of moments that cause me to question what is my approach. In terms of moments where I question my entire career, I don't think so. There have been moments where I've reflected, I need to change how much work I do. I need to change where my focus is. The pandemic really was a moment where we had to shift from in-person to remote care, where I was
Right.
wow, actually, I discovered, for example, how important it was to have a work-life balance. Mix it up. I need to do groups. I need to work in different environments, which is why I have the 3 different clinics that I have. And in doing so, I give the best care I can.
And so in those clinics, how's your staff based on your approach? How do they take that?
I am so fortunate to have some of the best staff a person could ask for. I've been work miracles trying to make my schedule work across 3 different schedules.
Amazing.
My colleagues are people I admire and respect. In my work in Remedy, for example, I do psychedelic assisted psychotherapy, and you get to work with another person. Usually psychotherapy is a one-person show, but in psychedelic assisted psychotherapy, you get a co-pilot. And working with my colleagues in such an extraordinary circumstance is so inspiring, because it's you're doing martial arts, and you see or you're doing jazz, and you see an entirely different style. And usually the people I work with are really excellent.
So this new thing, the psychedelic, what is that, and how is that serving those that are having this mental challenge?
Psychedelics refer to a broad class of substances, some natural, some artificial, and they all have in common a profound capacity to change the way we experience our consciousness. Psychedelics have existed, in some cases, for thousands of years, deeply braided and interwoven into indigenous cultures. While other psychedelics, for example, LSD or MDMA, these substances are being increasingly studied over decades, but particularly over the last 10 to 15 years, to be demonstrating a huge capacity to catalyze lasting change in mental illnesses such as major depressive disorder and PTSD.
So there's multiple drugs or forms that fits under this umbrella.
Yeah.
Oh, so I was always thinking there's only 2.
Oh,
And
there's a
there's a whole bunch. Oh, wow.
Yeah.
Wow. What are some of the lessons of the last turning point you would give someone that's interested in some of the things that you're doing, or they just want to get into this field?
For me, if I could recommend anyone who's remotely interested in therapy, the first piece of advice I'd give is to know yourself. And in terms of this career, reflect and find a way to articulate and remember and honor what brings you to this healing field in the first place. So for me, it's a deep appreciation and love of consciousness. In some ways, I think my career as a psychiatrist is more of an expression of my study of Zen. I think it's important for every person who wants to do psychotherapy, psychiatry, medicine, or any career that they want to feel deeply meaningful and worthwhile to identify what matters to you. I understand more and more that psychotherapy is both a science. There are techniques, there is a way to understand a human being, but it's also an art in that you're constantly, from moment to moment, learning to find the language, the image, even the look.
In that therapy, I think a little bit out the box sometimes. Can you take, is it like a template and you take that template that you're doing and how you deal with the patient? And then can you take that into like, let's say it's career therapy?
Interesting. I definitely don't think it's a template. I think I think any kind of human focused effort, whether it's therapy or whether it's coaching, requires integrity, like an
Yeah.
integrity of
Okay.
awareness, of practice, of context. I think coaching could be very therapeutic if like the pursuit of getting a job involves a conversation of why this job, why not another job? What does
Right.
this job say about you? What
Right.
comes up for you as you look for this job? These are this kind of inquiry can lead to really rich, deep, and transformative territory, and it's the attitude that I bring as a therapist.
And I love that. I even just love how you just spoke about the job and career. And what is that one thing? How do you find that one thing? What is it that brings that anxiety?
The one thing that when I hear about the one thing, I think about what is the thing that's holding me back?
Right.
What is the question that I actually need to answer? You may think you need a job, but maybe what
Right.
you're actually looking for, what you're needing to do is find the resources to actually learn how to talk to people so you can knock down on those doors and get the
Get that
interview.
job. Right. Nice, man. I love that so much. And again, I'm solely plus one and you're watching I Quit My Job. And I love the defining moments that you explained today, brother. I appreciate that. And thank you so much for sharing that time with me, man. It's amazing.
This is wonderful being here. You're doing an incredible service by having these conversations, and I'm honored to be here.
Thank you so much. Peace.